Welcome back, everybody. This is Outside the Box Demos. These are some of my favorite videos to do because we get to see kind of inside what we do inside of the performance medicine offices, the different techniques. And I'm, of course, with Ernie Dickson, the physical therapist here at Performance Medicine. He runs Elite Performance. What's going on, man?
I'm doing good. I'm glad to be here.
Now, did I say it right? Elite Performance?
Elite Physical Performance.
Elite Physical Performance. I'm so proud of that, by the way.
Oh, thank you.
Like all the work you're doing, I'm just super, super proud of you because I talk to your patients every single day and they adore you.
Oh gosh, I feel so lucky to be here, and it's a privilege. And I just having the opportunity to work with Dr. Rogers is just awesome.
Well, we're so excited to have you here, man. He's in the upstairs of the Kingsport office running his thing. And we're going to talk a little bit about the vagus nerves. And for the guys out there who've watched the Common Sense MD episode, Dr. Rogers talked about the vagus nerve. Can you just kind of talk to us a little bit about what that is, kind of the 101 version?
Okay, the vagus nerve is actually the 10th cranial nerve. And we have, and the vagus nerve pretty much makes up 80% of our parasympathetic nervous response. Okay. And it's called the wandering nerve. It's really the longest nerve that emanates from the brain. It extends all the way down into the abdominal area. But it has a big function as far as it affects the respiratory function. It also affects the cardiovascular function and the GI tract function. And so it's a big, has a lot of influence, that vagal response.
Now, so in this Common Sense MD episode, Dr. Rogers mentioned a device that you use, a procedure that you're doing. Is it the correct thing to say, procedure?
Yes, it's actually microcurrent. It's a form of E-stim, and it's a low-frequency DC current that we use, and I use it to stimulate points in the ear. It's called auricular therapy. Okay. And we're stimulating those points to kind of reset the vagal tone a little bit. So it's...
And you go through the ear.
Right. Like we go through the... it's called the auricular branch of the vagus nerve. And we go through the ear. There's about 7 points we do. They're actually acupuncture points. And we stim that with the DC current, and then that helps increase that vagal tone, that parasympathetic response.
So walk me through vagal tone, because that is, it goes right along with the vagus nerve, and I haven't talked about the vagus nerve without talking about the vagal tone. So how are they related?
It probably helps to go back and talk about the autonomic nervous system. Okay. We have the central nervous system, which is composed of your brain and spinal cord and the peripheral nerves. The things we always think about is like a nerve response. We also have the autonomic nervous system, and it's composed of the sympathetic nervous system and the parasympathetic nervous system. Okay. And the sympathetic nervous system is kind of the flight or fight response that we get. Like if you see a bear or something, then you have that flight or fight response. Your blood pressure goes up, your heart rate goes up, your muscles tense up, you take off running, and that's good. That helps you when you have an emergency response.
Ernie, that sounds a lot like when I know my mom's mad at me.
Yeah, exactly.
I get the hair on the top of my neck. It's like it's that fight or flight response.
That's when you know you're in trouble. So a lot of times when we have that response, or else when we're sick too, like when if you have a disease or an illness, then our sympathetic nervous system stays ramped up, or if you're in a stressful job, I think in our society today, most of us have, the pace of life is really fast, so we tend to have a kind of an upregulated sympathetic nervous system anyhow. Okay. But you see it especially in people that have any kind of disease, cancer, diabetes, COVID-19, the whole thing, it all kind of, those people all have an upregulated sympathetic nervous system. Okay. And if you think of the parasympathetic nervous system, it's almost the polar opposite. What it does is it sort of calms things down. It decreases your heart rate, decreases your blood pressure. It helps with that immune response. Yeah. And it's kind of, it's part of the system that helps repair and rest our system, whereas the sympathetic kind of revs everything up, and it kind of almost, it tends to, it tends to inhibit our immune system a little bit.
So what we're wanting to do is activate that parasympathetic nervous system.
Right.
And by doing that, it calms the sympathetic nervous system down. Is
Right,
that the
exactly.
right way of saying it?
Yeah, exactly.
Okay.
And like if you use COVID-19, say a long hauler syndrome, after they recovered, a lot of times they will still have a lot of symptoms. They'll complain of shortness of breath, fatigue, sometimes brain fog. They may have some GI complaints. And what you see sometimes is their sympathetic nervous system is still up, was still revved up, and that actually sort of keeps it keeps their immune response down, and sort of keeps it almost inhibits their healing. So what you like to do is just to get that vagal tone back up to normal. So you stimulate the parasympathetic system, and
so you increase the vagal tone, and what that does is activates the parasympathetic nervous system.
Because the vagus nerve makes up about 80% of our parasympathetic tone that we have. So it it sort of gets inhibited a little bit. The sympathetic overrides it,
right.
and it's it's kind of an upregulation. So you're trying to even it back out by stimulating the vagus nerve through that auricular branch through the ear is what you're doing.
So what do you mean by tone? Is that like a when I think of tone, I think of like a vibration. Is it like a vibration of the vagus nerve? Is that?
No, it's kind of different. It's not really like muscle tone so much. I use that word tone, I guess. It's sort of like you're just trying to even out more the response is what it is, because the sympathetic
Got it.
Is kind of an up regulation. So it's sort of hyper stimulated. You're trying to stimulate the parasympathetic. So you're just trying, they use that term vagal tone, but it's not like in the muscle, because it's actually a nerve. It's a
because we're talking a lot about stimulation,
right?
And so I'm thinking about does tone mean is that the mechanism? Is it like a sound or something like that?
Right.
But it sounds like it's not at all. It's just activating it.
In most cases, you should have a balance between the sympathetic and the parasympathetic.
Okay.
And in the parasympathetic system sort of calms things down, and the vagus nerve makes up most of that. But what happens, like I said, with stress or any kind of disease, it sort of gets suppressed. So it's sort of like you think of it, it's sort of revved down. It's almost the tone of it's down a little bit. So you're just trying to bring it back up a little bit. And you use the microcurrent because it's a low frequency DC current. In our body, our cells communicate with each other similar to like a DC current. So what you're using that low frequency DC current through the e-stim device to sort of stimulate those points.
Is it like fair to say by activating the vagal tone, or by working with your vagal tone, you're trying to increase your body's recognition of it? Because when I think tone, I think sounds. I'm like, okay, we're trying to increase the volume of the vagal tone so that, and by doing that, it's activating the parasympathetic nervous system.
Right.
Is that fair to say, or is that not?
Yes,
exactly?
It's kind of a hard thing to kind of, like kind of explain. It's kind of more of an electrical type thing, because our nerves, like our cranial nerve, like all the nerves in our body, there's like an exchange. It's a biochemical exchange between the cells. So, So what you're doing is kind of stimulating with the e-stim to sort of ramp it back up to where it needs to be, kind of a normal. It's almost suppressed a little bit.
Interesting.
And so you're trying to use the DC current to kind of sort of stimulate it, kind of pick on those points a little bit, and kind of just bring it up to neutral. You're just trying to bring it to normal levels.
And by normal, mean the balance between the parasympathetic and the sympathetic.
Right.
So you mentioned the points here,
right.
And for the people watching this demo, you're gonna see Ernie performing this. You might be watching it now, depending on what we're doing in post production. So we're putting a device in the ear. Is that right?
Well, actually, I'm going to be doing the unit. I'm going to have it in my hand, and I'm going to be stemming the points in the ear.
Okay.
And that's called an active stem. Now there is a part of it that you can do passively, where you put a little clip. It's like an electrical clip on the ear, on the tragus of the nerve.
Okay.
Or like the tragus of the ear, which is part of the the vagus nerve there, and you can do it passively and just step away. But I'm going to do it actively, where we'll have a ground electrode in the abdomen area, and then I'll be doing it through the e-stim unit, and it's called the active.
So this part of the earlobe is a part of the vagus nerve?
Well, no, on the inside of the nerve, on the inside of the ear, like this is called the tragus of there. On the inner part in there is kind of the acupuncture point for the vagus nerve.
Huh.
So,
okay.
and as well as the diaphragm, there's a point there where the diaphragm is and as well as the right lung and left lung. So I'll be stimulating those areas. That's why someone that has the long hauler syndrome, you're actually stimulating some of those lung points, the diaphragm point, and like as well as the vagus nerve.
Are you using the same points for each patient, or is it kind of depending on what symptoms they come in with, whatever they're struggling with?
It's pretty much 7 points that we do. And the other thing that I do a lot of times too is we'll do those points, but you can also do parasympathetic points on the extremities.
Okay.
Like you can do some on the wrist and hand and on the legs and the feet, because there's parasympathetic points there. So you can actually do the ear and do those points on the extremities, and that even gives you more of a parasympathetic response.
Does it kind of act, because I'm thinking acupuncture as well as E-stem,
right?
What's it closer to?
It's kind of, the microcurrent, what we're doing is kind of more like an electric acupuncture is what it is. So instead of using needles, we're using the microcurrent to stimulate those acupuncture points.
Huh.
And of course the points we're stemming are actually it's part of the auricular branch of that vagus nerve.
Is this a one-time thing, or is this something that, say someone comes in with long hauler, is this going to be a weekly thing? Like, how are you looking at it as a physical therapist right now?
On the research, they've done a lot of research in Canada on this, and the protocol usually says, someone that sort of is in a long hauler syndrome, you'd probably do twice a week for maybe 4 weeks. Which is a month's time. And that kind of gives time to reset things a little bit, because it takes a little bit of time. Like you do one treatment on it and you'll probably see a change, but then it's going to kind of come back. You just need to have a little consistency with it.
Is there out of curiosity, because, we're always trying to treat root causes here, is there a lifestyle change that goes along with this treatment in terms of, like, if I'm wanting to keep the parasympathetic and the sympathetic more balanced, I'm using, can you say the device again one more time?
It's microcurrent.
The microcurrent, is it called just a microcurrent?
What's actually a dolphin unit, and that's just a brand name. It's a dolphin unit, but it's a form of microcurrent.
Okay.
And it's just kind of a low frequency DC current that we use.
For the vagus nerve.
Right.
Super cool. Okay. So is there any other, is there lifestyle changes that you would suggest for a patient that's doing this in conjunction with it,
right,
in order to maybe increase the vagal tone for long term?
Right. I think all of us probably things like if you could do some deep breathing, some relaxation breathing, those kind of things, that stimulates the parasympathetic response.
Okay.
Things like yoga or Tai Chi, those type of things, you're kind of, like trying to, like calm yourself and that type of thing. So it's more, you're just trying to sort of find that happy balance between, because most of us, we all have stressful lives and we're running back and forth trying to do schedules and stuff. But most people probably have a lot more sympathetic tone than they do parasympathetic tone, just because we're in a fast-paced world.
Yep.
So it's like anything that if as far as exercising would be good, if you would like to walk, run, whatever you like to do for physical exercise, and then if you like to meditate, yoga, those kind of things, those all would help.
And with this unit, what we're trying to do is increase that vagal tone because it's been suppressed,
right,
and trying to bring the parasympathetic nervous system back up,
right,
more even with the sympathetic nervous system.
Sure.
Is that fair to say?
Sure.
Ernie Dickson, man, this has been a blast. I really appreciate you explaining this to me.
Sure.
Guys, we're going to get to the demo right now. I'm pumped for you guys to check this out. Ernie's going to be with Katie Gegley, our operations manager. She's going to come in as a patient, and you're going to perform this. Is that cool? Is that cool?
Yeah, sounds good. Thanks
so much. Guys, here they are.
Don't go away.
All right, guys, we are back with the demo here, and I'm with Ernie here. We've got patient Katie Gegley. We are going to perform. What is this called again, Ern?
This is a deep vagal nerve stimulation that we're doing. We're using microcurrent here, and so I'm going to be doing 7 points on the ear. It's called, like we'll be doing the auricular branch of the vagus nerve, and that's to kind of improve the vagal tone and improve that parasympathetic response. Is what we're doing.
All right, well, let's get started. Katie, you ready?
Yeah.
Okay, I've got the unit here, and I've got a ground electrode. It's right here. It's right below her belly button there.
Okay.
So, and that's kind of a ground electrode. This is the active electrode, and I'll be controlling the intensity here. So it's more of a low intensity, you'll hear a little sound that comes on there, and then when you hear the pitch goes up, that means that we found the point. So one of the points I'll be doing is here at the ear, and so I'm going to be moving this around, and you can probably hear that pitch there. So when I find that point, I press the button there, and we stem that point, and we do about 20 beats or pulses there.
So you're looking for that high pitch?
Right. So when you find that high pitch, that's the point. This is actually called the volume point, this point in the ear here. And it really kind of helps relax, kind of get that relaxation, response. And
is the sound for you or is the sound for her?
No, it's more for me because
Okay.
it lets me know when I'm on the right spot, because it measures skin resistance. And so when you hear the sound go up, that's when you know you're on the right spot. So.
And you're looking for 7 different spots?
Right. So the second one I'm going to do is, this actually this correlates with the diaphragm. So I'm going to move in this position here, and you can sort of feel that there. So we're going to stimulate that. Are you doing okay, Katie? Mm-hmm. Okay. So we're doing each of these points. Then we'll do 20 pulses here. Then I'll go down. And then this is the right lung right here. This is this one below there. And we'll do 20 pulses.
What is she feeling right now?
She probably feels a little bit of a kind of electrical buzzy sensation, maybe.
Is that right?
How would you describe it, Katie?
Like a youngin screaming in my ear.
Yeah.
It's like a sting.
Okay.
Yeah.
But it just is really loud.
Yeah. It's just because it's right here that, the sound you hear right in there.
Have you ever heard a ringing in your ear?
Yeah.
That's exactly what it feels
It's like a ringing in your ear. It's a good way to describe
it. And the
it.
vagus nerve, like this is the tragus of the nerve of the ear right here, this little area here. The vagus nerve specifically is right on the inside of that right there.
Huh.
So we do those points there, and then when we complete those, we can also do some parasympathetic points in the wrist and hand. So with the wrist, we'll probably roll this up a little bit. And so there's 3 points here that we can do. One is here, and this is also a volume point is what they call it in the acupuncture point. So we stem this area right in there. And we come over here in this one. And this is all to get that parasympathetic response going. But a lot of times you'll see a decrease in heart rate. You'll see the respiratory rate go down a little bit, just more of a relaxation. A lot of times the patient may even say they feel a little sleepy or something after they do it. So, and then the third one would be right in here in this middle.
Is it like a pressure point?
It's kind of an acupuncture point.
Okay.
So it's kind of like an electric acupuncture is what we're doing. We're using the microcurrent there. And of course, I can do more points than this. We can do some on the leg and things, but it's basically that same routine, that same protocol.
He did it for me when my heart rate was so high, and it always worked.
Yeah, raise your heart rate down.
Mm-hmm. We did
Yeah, I think we did several days.
And it really worked.
So it really decreases that heart rate.
Well, Ernie, thank you for demoing this. Katie, our patient, thank you for demoing this. Guys, tell me it one more time. I keep forgetting the name of the machine here.
It's a Dolphin unit. It's a microcurrent E-stim unit.
Okay.
And it's a low frequency DC current.
Okay.
That we're doing, and the current is coming through this tiny tip here, but it's not a lot of current. That's why they call it microcurrent.
Okay.
But it's real specific, and so it kind of
really pinpoints the area you want to.
It's not like a big electrode, so you're actually pinpointing when you're trying to find an acupuncture point.
Okay.
And it also picks up skin resistance, so whenever you hear that sound go up, that means you found the area. Like
that you want to stay on. Is there a time period you want to stay on each point?
Usually you try to go 20, 25 pulses. When you get a beep in there, that's actually, each beep is a pulse.
Okay.
So usually about 20, 25 pulses.
Ernie, thanks, man.
Oh, yeah, thank you. Thanks for having me.
Guys, thank you for watching for this episode of Outside the Box Demo. I'm your host, Ben Rogers. As always, we'll see you guys next time.
Don't go away.